Hi guys, James here from myPhysioSA. Today I just want to talk to you about preparing for a hip surgery. So it's really important that we consider a few things before you have your surgery, and also I'll show you some exercises for some prehab, just to keep you strong and moving better before your surgery. A few things to consider. So before you go in and have your operation, think about preparing your home and also other bits and pieces around your home for when you come back from hospital. Some important things are ice packs. Get them in the freezer because you're going to use them, okay? Thinking about setting your bed and chair heights up correctly if you can, and travel arrangements from hospital, and also you won't be driving for a little while, so make sure you have someone who can help you out. And the last thing is as well, any kind of gait aids or aids at home that you might need, check in with your physio or your surgeon or doctor to make sure that you have all the things you need. I'll just run you through a few prehab exercises you can try leading up to surgery to make sure you're fit and strong enough to deal with it after. So to start off our prehab exercises, we have 2 on the bed or lying down. The first one we're going to do is a heel slide. So just to keep your hip moving, we're going to do a gentle slide, knee towards your chest as far as you feel comfortable to go, and back down. Now if it's a bit tight through your hip or you get a bit of pain, lying all the way back might make that just a little bit easier for you. So lying back and seeing how far up you can go, just keep it moving, okay? The next exercise we're going to do is a bridge. So with your feet flat on the bed, about hip width apart, trying to pick up through your heels, push into the bed and bridging up nice and high. Okay, it's important to keep your hip muscles nice and strong, so we're going to use our hip bridge to do that. Okay, 2 sets of 10 is fine for those kind of exercises, and we'll go on to our sitting ones next. So our sitting exercises, we're going to do some leg extensions. So sitting back into your chair or on your bed, we're going to be kicking out nice and straight, try and get a squeeze through our quads and coming back down. So our quads are obviously important for getting in and out of chairs and mobility after your surgery. It's important to keep them nice and strong. Our next exercise we're going to do is some sit to stands. Now if you feel comfortable enough, try not to use your arms. If you need to, that's fine, you can use your arms, but we're just going to try and stand tall and back down. Okay? So up and down a few times. Just try and keep all your hip and your knee and all your lower legs working hard. Another exercise that might help us after our hip surgery, after we've got a little bit of pain in our hip, is actually doing some upper arm exercises, so some dips. And this will help us get in and out of chairs, but also if we use some gait aids, making sure we're strong enough to deal with that. So if you come forward on your chair, you can use your arms to try and lower yourself down and back up. If you get some pain through your hip, just be mindful about the position your legs get in. And we'll move on to our standing exercises. Our last exercise is some standing hip abduction. So these are the muscles that we use when we stand tall or stand on one leg. You may have some pain when you do this exercise. Just be mindful of that. If you are able to do it as well, some resistance bands or other equipment might help. But holding on for balance, we're going to use our hip. We're going to push out to the side and back in to try to use the outside of our hip. Okay, same with all our other exercises, a couple of sets of 10 is absolutely fine. And hopefully after doing all those exercises you feel fit and strong and prepared for your hip surgery. Just remember all those tips at the start where we make sure we have our surroundings and our home set up before our surgery, and good luck.